When you're having lower back pain, and especially when you've herniated or have a bulging disc in your lower back, one of the hardest things to do is changing positions, either going from a seated position to a standing or sitting back down, and you're running into all kinds of pain that flares up. And that pain can be very scary in a sense that you feel like once you stand up and this pain starts locking down your back, like you can't actually stand up. But what you should be doing is standing up more erect or straight because that will actually help you out. We're going to show you how to do that. So if you're standing up from a seated position, just like Lori's about to do, when you rise up, you'll probably feel like you have to stay hunched over because it's impossible to actually get up straight. But I want you to put your hands back here and slowly start to straighten your legs and straighten your entire back up. Just get to this position. Now, when you get there, it'll be hard to breathe. You'll feel a lot of tension and you'll feel like this is really wrong, but it's not. Just take a breath. Give it a couple seconds, 10, 20, 30 seconds, and then you'll notice that pain will start to dissipate. Now, once here, you can actually increase this exercise by doing a slight back bend. Now, you want to make sure that the hands are right at the top of the hip bones, not actually in your lower back. They are on your hip bones and your tush muscles, not your lower back. And you're going to slowly lean back as you exhale, tightening in your stomach. And then you go back to your neutral position, inhaling. Exhale, going back, pressing the hips forward, tightening the stomach muscles gently. Don't go too far back and back forward. Now, during these, you shouldn't feel like a great increase. You may feel a little bit of tension and a little twitchy, but it should quickly dissipate as you get into this position, and then you go forward. Do anywhere from 3 to 10 reps of those, and you should be good to go for walking around at the party or at your house or wherever you may be. Now, when you go to sit down, you can also tend to have some of the same reactions. So go ahead, Lori, and sit on down. And you may feel some tension happening. A lot of times we have to round forward as we go to a seated position. And then anytime you're rounding forward is what's going to create this problem in your lower back. And that's why we have to do these exercises to help now pull that disc back in. So once you're here, what you can do are an anterior pelvic tilt. And that fanciness there just means that you tip your hips forward. So again, you create this curvature, and you can just hold that in, hold it for 20, 30 seconds and see if that pain relaxes back. Or just like the standing version, you can do an exercise with it where you release to neutral, don't round, that won't be good, and then pull in. So you're exercising these back muscles. It's like you're trying to stick your butt out, and you pull in. By exercising these muscles, both here and when you stand up, you're giving your body the support it needs to stabilize the disc, and it rewards you by releasing the spasm that it's doing in your low back, which is creating that low grade like gnawing pain or that tension that you feel it's zinging you right there. So doing the exercises helps balance that out. So you can just pull in. Excellent. And then relax there. Another thing that can help you out in case your problem is dealing with some SI joint or some hip joint being unstable, maybe you crossed your legs or something like that while you're sitting, you can do an inner thigh squeeze. So you put your fists together and you squeeze the knees. Here, let's have you spin forward for this one. So what she's doing, she's going to have her hands there. She's going to squeeze between her knees. So make sure you're not rounding during this or anything like that. You may even get a little pop, and that's okay. That's just releasing the pubic symphysis, and that's fine. But you're just squeezing in. Now, you can do anywhere from 5 to 10 reps of these. And I have a lot of people, by just doing this inner thigh exercise, it activates the pelvic floor, and that gives them a lot of pain relief. So you can try both of these out together, or you can try them out individually, see which one works for you. But these are great things to do while you're sitting. And while we're on this note, 2 things about sitting that I want you to stay away from because they will prevent you from getting a lot of this pain that we're having. Don't cross your legs when you're sitting. It really becomes a problem if you're always crossing the same leg every time you sit because you're destabilizing the musculature down here, you're offsetting the hips, and that's one of the things that may have gotten you into this problem in the first place with hurting your back, so make sure you're not crossing your legs. Secondly, and if you don't mind turning back over here, When you're sitting, use a lumbar support if you can, or like have a rolled up jacket. If you're going to the movie theater or something like that, always take a jacket with you. I always have a jacket with me, or on a plane flight, I always carry a jacket because I'm just going to put in my low back so it creates this natural curvature in my low back. Now, if you have a spondylolisthesis, an anterior slippage of your spine, this may not be the thing for you. Most of us don't even know if we're having that thing. But if you happen to know and your doctor's told you, then the lumbar support may not be what works best for you. But you'll know, you'll see, and you'll feel it. But grabbing a jacket, throwing it in your low back is excellent. Just make sure if you don't have a jacket or anything with you to help the support, maybe you're sitting on a bench at your kids' soccer games, just don't round your low back. Sitting in a slumped lower rounded back allows those discs to once again protrude out the back. And if they flare up, you may not feel it so much when you're sitting, but man, when you go to stand up, you're going to feel that. But that's okay, because now you know an exercise to do when you stand up and you're having lower back pain. So these are two great ways to get out of that lower back pain when sitting or transitioning from a seated position to a standing position. Hey guys, if you like this video and want to see more like it, be sure to subscribe to our channel. Also, click that bell. Then you'll get notifications the next time we put out a video. If you like us, click on the like button. You can also leave us questions and comments below. We love it. And see you next time.